Thank you, Professor Shah, for joining us. Today, we would like to talk about the recent global pandemic, COVID 19, or the coronavirus disease in the context of Bangladesh. First of all, we would like to know about some basics of the virus. There's a lot more confusion nowadays. So, Dr. Shah.
Okay, thank you. Tell you the background. The coronavirus we know really very little about it, and you can understand that every day new things are getting unfolded.
Yeah, exactly.
And that's interesting. If you just look behind, then coronavirus is not really new, but this COVID-19 is new. So there's some changes, but the coronavirus is there in this world for many, many years, and people who are working on this.
Yes.
Unfortunately, nobody was taking a lot of interest on it. I mean, if you go back and then see, there are scientists who were working for this for almost more than 40 years.
Then
But
why
on
do we
those
call this novel?
is novel coronavirus because this is a new coronavirus. That's why it is novel coronavirus.
Okay.
The coronavirus are many. So
Okay.
the Susan Weiss, she was working on this for almost 40 years. And when she was working, people were looking at her and thinking, oh, she is working with something which is completely backdated and which has no importance for human being. But now with this novel virus, I mean, the SARS-CoV-2, that was SARS, but now it is COVID-19. But now people are realizing, oh, we really missed this opportunity. We could have learned more. If you look at coronavirus, then it is a very small virus like any other virus, but we have but only 10 genes. And with these 10 genes, this virus is really showing how it can dominate the human being globally. But we have even a smaller gene virus, which is like dengue. So it's not necessarily the gene is the only factor that how many genes you are having, but it is also important how you adapted, how the virus adapted itself to survive in human being and really cause the disease. Consider coronavirus in the previous days when it was only considered as the just like little bit of sneezing, little bit of maybe cough and not even the cold or something. But now it was only known as the upper respiratory tract infection virus. But that it has been changed with time and it has gone through different other animals, birds, especially bat. But we don't know really. You may, if we are talking about this maybe a few weeks later, we may really come up with some other things also, the where it has gone through um, to come to this stage. So now it is no more an upper respiratory infection. It is both. It can be upper respiratory, as we see a large proportion of the population are really remaining very mild or sometimes even asymptomatic. And contrast to that, same virus will really cause very severe disease. Though we now, our very clear perception that mostly the elderly people are getting affected. But we also gradually gaining the knowledge that it is causing the disease. I mean, even it is causing severe disease among the, younger population as well. So it is really very interesting. And it is a new virus, of course, is a new version of coronavirus. And unfortunately, we have very minimum knowledge because we never studied this in further detail. There is
So,
no
so
modeling also. Yeah,
So
go ahead.
when the virus gets more virulent, like sometimes it remains asymptomatic in the patients, but sometimes all on a sudden people get fatal consequence.
We really do not know because we have seen there are some sequencing already done from different places and from the dead cases and also the cases with very minimum clinical symptom. But until now, really, scientists could not really find out any specific differences between these isolates. So still we need to maybe study more to understand what is the main cause of these differences of clinical syndrome or the clinical severity of these cases. We are not really sure. We know very little about this, honestly.
Okay. So, according to your opinion, what is the current situation of coronavirus in Bangladesh? I mean, how grave is the situation, or should we be worried?
I think the whole world is thinking about this. Whole world is thinking that Bangladesh is at the brink of the disaster, or maybe a very big wave is coming at us, and we don't know really what's going to happen. I think the next 1 week or maybe 1.5 week will be very critical because we now can see that the virus has Now infection has moved to the community level. So we are not sure really how it will behave in next 1 or maybe 1.5 weeks.
Uh,
I mean,
i-
that's what I'm expecting.
if I explain my question further, I exactly wanted to know why the situation is so worse in Italy and not in South Asia. Like sometimes we claim that in South Asia it's not that dangerous, but why this different kind of manifestation in different parts of the world?
The manifestation wise, if you consider, so you asked me other question. Let me go back there, then I'll be
Okay.
coming back to this. You mentioned what is the situation, whether it is grave or not. We not really know the situation because we really could not screen large number of cases. Though there are instructions, though there was, resources, because funding was available, in fact, because the government really poured money to do something. And we heard many times that from the higher level of the government, the instruction came, but I'm not sure that all those are being implemented properly. The reason, if you think about this, we do not have the infrastructure to do the tests. At the same time, we could not really involve more and more laboratories to do these. Whatever the available laboratories, those are not being used. So, but anyways, it is not very late, but we could have done maybe little earlier. That could be one important thing. So I'm really optimistic that maybe we'll be not having an Italy scenario. We'll be having a much better scenario, and we'll be saved. Maybe I'm optimistic about it.
Okay, so do you want to say that a reason of low number of cases is due to the scarcity of our test kits or
Uh,
testing facility?
It's a very interesting question. I don't know whether it's maybe chicken and egg. I don't know whether there was a scarcity of kits because we never even try to test this. For example, now we have kit. We have now labs. We hardly have any specimens to test. And we hardly have people who are really coming to you and giving the specimens because people are, is a dogma. It is like we want to hide it. Number one, the panic is to examine a patient who is really having minimum, not even it is a case of COVID, but even any kind of pneumonia complication, they are not really treated very good gesture. So all these are problematic, and that is the reason we do not know why we have less cases. But if you look at this, I believe we really missed cases. For example, when we have 45 positive cases, we had 5 deaths. That means we have almost 10% deaths. And that means it is the highest number of deaths. It is not the number, it's the proportion.
Yeah, yes.
That means if we could have screened more, we could have find more, we could have really singled out them as the South Korea did. I mean, each and every individual case was being tagged and was being followed, not only to make sure that they are remaining isolated, that particular case, almost like an index case, confined to a place, and also followed these cases very carefully, how the disease is behaving. So they also gained the knowledge for it. However, you should also consider that what is South Korea and Bangladesh is a very different. It is one of the most populous country, and possibly we may have a lot of people at number one, but our education, our literacy are not really in that level. I mean, even in the literacy may be good, but not the education that way, in fact, honestly.
So what is that kit like that we are using right now in Bangladesh?
No, we are using PCR. Still, the PCR is method that we are using. We are using different kit in different places, but I just want to that we should all the kits whoever is using should be standardized or even should be synchronized in a way that we all know who is using which kit, so then we'll be getting the report perfectly. But I think most of the kits are very same kits we are having, so not the diagnostic, the rapid tests are not yet being used here.
So reagent is an issue. Like CHRF had a PCR machine before, but you didn't do it because there was no analyzer or the reagent.
Reagent is also not a problem, in fact. The kit is one thing which is really coronavirus specific, but other than extraction or all those things are there. And whoever using, and we are working on respiratory virus for last few years. So we had everything, but only did not have the coronavirus specific primers and probes. So those we are having, and the kits are available, the reagents are available, and everything you can really buy. I don't think that was a problem, but now we have large number of labs. I hope that a lot of tests will be done every day.
The reason I ask this because there are some other labs in Bangladesh who have PCR machines, but they are not capable of testing this corona cases. So I was wondering what was their obstacle.
I think having PCR machine is not all. You need to understand that why that those PCR machines are used and what is the experience of that particular lab. I mean, I'm sure that there are many labs who are having real-time PCR who are working maybe in the fisheries and agriculture. But that, if I really go and give it to them, I'm sure they can do it. They have very good knowledge, but at least you need some orientation. Number one. Number two, this is a virus which is extremely contagious. So, I mean, you can give it to them, and they're all knowledgeable, and they know real-time PCR, all the basic things, all the practical things. But again, you have to know what specimens you are dealing with and how are you going to deal with. So that's all those are important. That will take time, and we do not have time now. We really want to start now. But the questions we should ask when we go to a lab with PCR machine, we should ask, did you really work with the respiratory viruses before or the viruses before? And what is the safety of your own lab before you are really starting to work on this? That's very important.
So, what should we do now for the protection of the nation? What would we do more?
I think it is main thing we should do. We should really screen more and more, and immediately we should really isolate them. I mean, the problem is if we don't do this, number one, we'll be in risk. Number two, if we don't do this, we'll be in, maybe we do not have the cases, and that is the reason we are screening less. That's fine, but let's screen more. Make sure that yes, we do not have many corona cases or many COVID-19 here. So that's perfect. That will be giving a lot of confidence to our people. They'll be relaxing rather. This is one. And what was the other question?
What could you do more like that?
I think what we could have do more, maybe we could have started these few weeks before what we are doing now. That's number one. But number two possibly is when the people started coming back to Bangladesh, we really could not anticipate possibly that how many people will be coming and how to accommodate them. And also whatever instruction was being given to these incomers or to these expats, that is not really followed properly. Either maybe we could not instruct them properly or we could not be more regimental. I think if you consider China, that's the one way of really controlling everything. If you look at South Korea, that is another way of looking at this. If you go to US, the first in this coronavirus infection started in the West. However, it is declined significantly, and now you look at the East. So California and New York, what a contrast. So that depends how disciplined you are and how really maintaining everything what is being said by everyone. Say, okay, keep distance, be confined, all those things. But we did not do that. So that's a very big problem, and that is making us really scary.
Globally, there are so many things going on for developing a vaccine against it. So, what is the situation of vaccine development?
Globally, there are many industries, many universities, including NIH and all these, they are trying, but most of the time these are confidential and we really do not know how much progress. Someone's saying 1 year, 6 months, but I'm not sure whether we'll be, if it is taking, even if it is very early, 6 months, and it will take maybe another 1 year to come to us because the discovery of the vaccine and then producing it in bulk is not really very simple. I mean, you need more industry, more than one industries to be involved.
Yeah, it's a
To
complex
generate
process.
millions of doses. Yeah.
So, what could be the natural course of disease like how long the spell might continue, how long people should remain isolated, something like that? Can we predict anything?
I can only predict based on the knowledge of other diseases. For example, the way it's going, as we know that about 80% of the cases are not really very severe. They are having the exposure, they're carrying it. So that means they're getting some immunity. And if it is going on, the wave is going on all over the world. And if it's, but also we do not know how much immunity it will be giving with this exposure. But even if it is giving some exposure, then the most of the people will be immunized, and that really helping telling us to stop. So that could be another 3-4 months, that could be even 6 months. It depends on how it will be behaving in the coming days. That is the most important thing. That's the only thing I can consider. But the way it is going, possibly there will be immunity among the people who got exposed to this coronavirus. I cannot say more, maybe, because that's true for many other organisms like this.
So, is there any mutation anywhere in the world? There is event of mutation of coronavirus detected.
There are some changes, but it's not really anything very significant which is really making itself more different. I mean, there are not a lot of strains are not being sequenced, but the cases who are being sequenced, they're not really significantly different. They're still behaving in the same way with some changes in the gene, but not really anything remarkable.
Since there's a very few number of genes, like 10 genes, is it possible to change the genetics of coronavirus in the lab to stop its spread?
That's really a very common question to be asked.
Yeah.
I am really possibly Trump's Trump.
Okay.
I mean, you can easily understand from the sequence that whether it is being manipulated or it's a natural change. Nobody really confirmed yet that it is not natural change. It was being manipulated. That's not a scene. I mean, I've not seen anywhere, and many where it was being clearly said this is a natural development of this virus. And yes, and if you look at the 100 years, so the SARS, it is almost yes, or 10 years. Something like no, the last pandemic was like this, but also SARS 2, 10 years before.
So recently we also got to know about the spread of hantavirus in China. So does it poses any risk of spread in Bangladesh?
I have no idea. Sorry.
No problem. So we have talked too much about the technical and scientific aspect of the virus itself, but let's talk about some psychosocial consequence of this disease in the society, or the behavioral aspect, if you would like to say something about that.
I'm gradually thinking more about this topic than that of science. The reason this pandemic, and also especially the countries like Bangladesh, when people may starve if we really continue to remain isolated for several more weeks, that could be a very, very big problem. But also the panic that we are having all together, it is really, very different scenario. And I am just feeling that this coronavirus vaccine or the wave in Bangladesh or maybe all over the world will be telling us that human beings cannot live alone. They should live together and they should help each other. And that is the only way they can survive. Is no matter how strong you are, whether you are in US or you are in Bangladesh, you cannot really protect anything. This small virus, we could not do anything almost against this virus. Nothing. Look at Italy, look at Spain, look at Iran, what's going on there. So we should really realize it, and this realization will be helping us to be a true human being in the coming days. But I'm also looking at when I'm really working on this disease and when I'm trying to understand or help the government with our support from our whole team who really, get out of all work for research. They're really dedicating their time to detection of coronavirus. We are also understanding that there are hardly any place where really you are being welcome when someone is coming and trying to tell you that that person has an infection which is very similar of this COVID-19. So it is such a shame that they are not even getting any kind of favor for any of us. It is like I'm just thinking of what was the situation when we had a lot of leprosy. People are not even going to around that place if anyone is having the leprosy.
Exactly.
It is very, very similar now. The people are shuttling from one place to other, but they are not getting it. Let me give you the example. So when we got the letter from the government that we are being assigned to test the specimens for coronavirus, but those specimens will be coming to the respective hospitals. They will be collecting the specimens and sending it to us, and we will be testing it. That is our role. We really did not receive almost not even a single specimen in a day. Consider, we are really saying, they are not screening. We should do more tests and more tests. Who will be really giving you the specimen? There is no way. But we are not. That's I say that why we cannot really leave alone. I am declining one person that okay, I cannot test your specimen and I cannot examine you. And you are sending it to another hospital. That person is moving and spreading coronavirus. Going and talking to few person there and again declined. And then some coronavirus are being spread there. And then some people maybe got infected when they are having the conversation. They're going to another hospital. The virus is being spread in other places also. So what is happening? The person who is declining, that person may be next victim of this virus because you are not really allowing to screen. And if it is a case, and then you really isolate that person, they're saving not only that particular doctor, or that particular health worker like us, they will be really saving many other people in the society because one, two, four, it goes geometrically. If you cannot really stop that, that will be a disaster. We cannot blame anyone. And we cannot really blame that government will come and government will do everything. It is our responsibility.
Yeah,
So I can
definitely.
see, sorry?
Definitely, we cannot blame that.
Yes.
If we see the scenario that in some Western countries the situation is much more serious than that of other parts, other countries, so it could be anything in any place.
I mean, just look at this, look at the videos when you are seeing the Italy, when every day more than 700 people are dying, and how people are really taking the dead bodies from one place to other, how the beds are being, how they are pushing the trolleys, and we do not have anyone. Our pneumonia beds are vacant. Nobody are there. It's really shame for us. Anyways, that's my
Yeah.
feeling. And I really mentioned less. It is even more.
Yeah, we hope that the situation will be much more manageable in Bangladesh.
I hope it will change. One of my friends just asked me what I was thinking for myself, but he asked me, can you tell me where should we go if I got this infection? And are there any way that you can come and help me? I did not have any answer. And I asked myself many times, if I get this, because I go to the lab almost every day, I work with the team. And if I get infection, who will be coming to take me to the hospital? Who will be giving me oxygen?
Yeah.
This will be a challenge. This is really a challenge. But we now have few hospitals. We can admit one patient yesterday to Kuwait Moitri, and it was relatively easy to get admitted. I believe we need more and more hospitals to be ready. I wish that we will be not needing them, but we should make them ready.
Thank you, Dr. Shah, for your valuable time. We will get back to you in future to know more about the disease. Thank you for now.
Okay, thank you.